Well, thank you for the nice introduction. Good morning, everyone. Hope you're awake. I'm on West Coast time, so I'm a little bit confused, so bear with me. Well, when I was thinking about the comments I wanted to make this morning, I actually started thinking about all the things we heard yesterday, and I thought I'd start with a few reflections about the things we talked about yesterday. We talked a lot about the diverse pathways to young adulthood, and how there are many important gender, racial and ethnic and socioeconomic differences. And what really struck me was that all the different presenters came from different perspectives, talked about somewhat different substantive areas, and did independent reviews of the literature in those fields. And I was really struck by the great agreement about some of the conclusions that people came to independently. And also including my own background paper that was just mentioned that you have in your materials. I think you'll see some of the same themes reflected in that. And it just really struck me that we all worked independently and came to very similar conclusions, which I think is a good thing. So I think there's a lot of commonality here that we need to pay attention to. And you'll see in some of the comments I'll be making in my little talk today, some of these themes will be reiterated, but I'm also wanted to point out a few other things that I thought were particularly important. Before I get into the topic of the preventive interventions, I did want to say a few words about one of the issues that was raised yesterday that I think I have a little bit of a different perspective on, and you can read about it in the background paper. I think what struck me too was that it was mentioned many times yesterday how there's many diverse pathways, that there's so many different options for young adults to move into young adulthood and do that differently, that this might be overwhelming to the young adult, but also it might make it difficult for us to study this transition time. And although I think it's true that social norms around when young adults are supposed to move into roles, when they're supposed to complete them, and what kind of order, these social norms have weakened considerably. So I think there's a lot of flexibility, but still, my view is that there's quite a lot of patterning as well. And I think it's important to look at overarching themes. What my own research, which you can read about in the background paper, and also other people's research has shown, is that when we actually look across all these diverse trajectories of transitioning to adulthood, there are some striking patterns that I think we need to pay attention to, and it will also help us in understanding and studying this phase of life. And what I think is important to see is that although there's more variability, there's only very few trajectories that are very common trajectories for many young adults. And I think what we see is there are two interrelated factors that organize and structure the life course. And those, and they were mentioned yesterday many times, those are both college attendance and family formation. And as you know, those young adults who go on to college tend to postpone family formation, both marriage and particularly parenthood. And increasingly, and I think that hasn't been mentioned so much yesterday, they might not only postpone it, they might even just choose not to have children at all or not marry at all. And both of these things are interrelated. Those who do not go on to college tend to have families earlier. Those two factors are really the two most important factors that seem to structure the life course during this life phase. So I think although there's more variability maybe than in the last century, I think there is still not that much variability that we can study this life phase. That's just one comment, and if you're interested in more details, please read the paper, and I'm happy to talk to you about this further in person as well. So maybe let's go on. Some of the other thoughts I had that I would want to like to point out that was also mentioned yesterday is that there is a striking stability and continuity between development in earlier life, in childhood and adolescence, and what happens in young adulthood. And I think this is important to recognize because what this tells us is that there is an important place for early prevention. And I think we know this, and I think it's very important to remember this. The good news is we know a lot about how to do this. There are a lot of really good preventive programs. We know what works. We know how to do that. So that's the good news. I think the other thing to remember is although there is a lot of stability and continuity in development, it's not a deterministic process, absolutely not. And what I think is so important about studying or paying attention to the transition to adulthood as well as other phases of the life course where you have a transition happening is that these phases can include turning points. These are times with a lot of opportunity for change. And this is, I think, why we have an opportunity and why it's important to study this period of time. But I would also say that turning points create opportunities for better or worse. You might have people who might be have a chance by experiencing turning points to change from a maybe less healthy trajectory in adolescence to a healthier trajectory in young adulthood, but the reverse could also be true, that some healthy pathways get derailed during the transition to adulthood. So I think both of those things are important. And I think I would like to point you to John Schulenberg's work who has written a lot about this idea of continuity and discontinuity in development. I think this is something important. But I think what we know very little about, and this is kind of what I would like to highlight, is that what we don't really know is what the potential is to intervene during this time period, particularly because there seems to be so much continuity and stability from earlier life, but there's also this opportunity for change. And how much opportunity for change is there? When, where, how can we intervene? I think we know very little about this piece. And I think this is the point where we need more empirical research, but also more theoretical development and theory testing. Based on this background, given the situation that we actually might not know that much about how to intervene during this period of the life, I was really curious to see, well, how are there already programs out there that are specifically targeted to young adults? How much is out there? What's out there? Is there anything good out there? And so I thought for the purposes of this forum, it would be interesting to go and look. And I would like to acknowledge Tara, I saw her earlier, I'm not seeing her, but Tara Monero, who's the research associate here, who was absolutely crucial in helping me with this review work, because as you might know, there are hundreds and hundreds and hundreds of programs that we had to review to find some that were specifically targeted on young adults, and I'll tell you what we found. So we reviewed 8 different inventories. I'll show them to you briefly. You might be familiar with many of them. These are the most prominent ones. These are freely available online. You can go and search by keywords. They're wonderful resources. They're slightly focused on different substantive topics, but there's also a lot of overlap. They use somewhat different criteria in terms of evaluating the evidence for different programs, but all of them include and rate programs based on the available scientific evidence with respect to the evidence base that we have, and use different criteria and scales to kind of rate what's really good, strong evidence and what's less so. So we looked through these 8 inventories to see what's out there, what good evidence there is for young adult programs. Our goal was to identify tested and effective programs that specifically targeted young adults, and we roughly included this age range between 18 and 30. What we didn't include were programs that were targeting adults generally. They might have done some work on young adults, but we didn't include programs. There were many programs that specifically are based on a general population, but we did not include those. Just to be clear about the criteria we used. So here's what we found. We identified 26 programs in these 5 topic areas, and my expectation was that we wouldn't find that many programs. And I think 26, given that there's hundreds and hundreds and hundreds of programs out there, is kind of what I was expecting. And you can see that we found 14 programs that were targeted in the area of substance use, a lot of alcohol use programs, but also other substance use. 5 programs focusing on STI and HIV prevention and risky sexual behavior more generally. 3 programs that were focused on educational and vocational skills. 2 programs on suicide prevention and mental health, and then 2 programs focusing on crime and antisocial behavior. If you're interested in the specific programs, again, I point you to the paper that has a table that lists all of the programs, and you can go to the inventories. We have links included if you want to learn more about the specific programs. We just don't have time to talk about all of them. One thing I wanted to say as well is that if you look at the list of the things that we included, that we found, your program that you might have developed or that you know about, it is a good program, might not be included. I think this is an early look. This is our first stab at this, trying to see what we can find using these criteria. I think there's a lot of opportunity, as we heard yesterday with respect to mental health programs, there's a lot of development going on, and I think those things would not be reflected in here, so keep that in mind. I think one thing that struck me when I looked at this list of substantive areas, this kind of makes sense given what we heard about the health risk behaviors that young adults are particularly vulnerable to. But one of the things that I thought was really missing were programs for parents. And I thought, well, I know there are a lot of parenting programs that we know work. And particularly when you think about programs for parents of preschool-aged children, well, most young adults will have preschool-aged children. So I thought, let's look what's out there, because those programs seem applicable to this population, although they're not specifically targeting young adults, but most young adults will be parents of preschool-aged children. And so we found actually 17 programs that had really strong evidence around this, and these are only the preschool-aged programs that are focused on preschool-aged children. There are additional programs for older children, including adolescents. And I think what was striking is that all of the inventories that we reviewed agreed on 4 particular programs that I'm listing here: the Nurse-Family Partnership, Triple P, Incredible Years, and Parent-Child Interaction Therapy. All of them mentioned them, all of them had really good, strong evidence for them. So I think this is, again, a lot of agreement in certain areas of this life. And I wanted to point this out since young adults are likely to be the parents of preschool-aged children. So let me make some kind of summary remarks and some recommendations. As I expected, I think there were only a limited number of programs that specifically targeted young adults. So I think there's a lot of room to do further development, given that we've identified that this age group is at risk and there might be a potential to intervene. As was pointed out yesterday, I think this is one of the themes that I found throughout my review, and I think everyone mentioned this. Many of the programs, particularly in the substance use area, of course, were focused on college students. But as many have pointed out, substance use is actually, except for alcohol use, all of the other drugs have higher rates among non-college populations. So I want to say again, let's not forget the non-college population. I think that is one theme that has come out very strongly in my research, and I think in the themes that we talked about yesterday. I think that's very important. The other thing, I mentioned parenting, but if you think about the topic areas that we identified, the other thing that struck me was that there were very few programs that focused specifically on the skills that young adults need to develop and need to have to transition successfully. And in particular, I thought, well, relationship skills are one of the things that they would need, as well as skills around managing finances. And I was very pleased that yesterday in the young adult panel at the end of the day, that was mentioned. And I was like, well, I'm glad that, I mean, I kind of thought this might be important, but that the young adults themselves thought this is something we don't learn anywhere else, but I think is a really crucial skill. And I didn't see any particular programs that more broadly focused on kind of building the young adult skills. So I think that's an area that we should think about. So what would I recommend kind of as next step? As I mentioned, we don't know a lot about really the potential of how to intervene at this life stage when. So I think we need to do more research around understanding what possible turning points are, how they happen, when they happen, for who, and so forth, and then also to understand what the potential is so that we can develop programs to intervene. The other piece, and I think this is, I'll maybe put up the next piece. I think there's two things. I think on the one hand, this idea that we shouldn't only focus on college students. Everyone is really at risk here. Really, I think makes the point that it's important to think around universal preventive programming. I think everyone, and this is also a theme that came out yesterday, I believe, needs the attention at this age. But also, I think we need to think about some of the subpopulations that are at particular risk. So I think both approaches are very important. And I think what I didn't see so much when I reviewed the intervention programs that are out there is I think we need to match on the particular young adult health risks to what we need to develop. For example, something I didn't see are programs focused on obesity, for example, and physical activity. Some of the substance use programs, and I think Helene White mentioned this, kind of include this a little bit in terms of mentioning how much calories you consume when you drink and so forth. But programs specifically focusing on obesity for young adults, I think that was one area that I didn't see much. Let's see. And so, as I mentioned, we focused on programs that were specifically, explicitly targeting young adults. In the manuals, they were tested with young adults. But as we were reviewing the different programs, it was kind of striking that there are a lot of very good programs in many different substantive areas that we know work, but they're studied in general population. So I think here's a great opportunity to prioritize testing some of the programs that we do know work already, but test them with young adult populations specifically in well-designed studies. I think there's a great opportunity to see how some of the programs that we already know work, whether they could also work for young adults and whether they need to be adapted in some form to this life stage. And then I think one of the challenges of prevention science in general is that although we have these inventors, we know what works in many areas, we really have not achieved more widespread dissemination with high quality implementation, which is so important to really achieve community-wide public health impacts. And I think this is the other piece that we need to pay attention to if we want to really make a difference for young adults. I think the good news is we have the programs, we know what works, and we also now know what works in terms of achieving some more widespread dissemination. One of the programs that I'm working with, and we have done a randomized trial on, is Communities That Care, which is a community prevention system and helps communities do science-based prevention. There are other programs like Prosper, that work similarly, and I urge us to pay attention to these. They're not specific programs, they're more systems in terms of helping us understand how we can do prevention well and achieve widespread public health impacts. So these are kind of my thoughts. Thank you.